Welcome back. So now we are going to look at Arsenicum album. It's a favorite medicine of many people. We know during the COVID time, Arsenicum album is the medicine that was selected as the preventive for COVID. Now we'll go into the details of it. Great anguish and restlessness driving the person from place to place. Great and sudden prostration, sinking of vital force. Intense burning pains. Intense thirst. Drinks often but little, as cold water disagrees. Dyspnea on motion, especially ascending. Vomiting and stool simultaneous, aggravated after eating or drinking. Modalities: aggravated in cold air, from cold things, cold applications, and 1 to 3 a.m. Aggravated from movement, ameliorated by warm air, warm room, warm applications, hot applications, relieved by sweat. Remember, I'm reading from Nash, and Nash has a very selective group of symptoms that he gives in the beginning as the keynotes. And according to Nash, restlessness, prostration, and pain burning are the three most significant indications of Arsenicum album. All these things are out of proportion to the condition. So you may have a condition, the condition may not be so severe, but the patient would be very restless and anxious and very weak and would say that I'm having burning pains and they are too intense to bear. Thirst also is intense, but the patient would drink a little quantity of water at a time, preferably lukewarm water at a time, because cold water disagrees. Arsenicum is generally very chilly. They don't like cold things, cold applications, cold air. 1 to 3 a.m. when cold is reigning supreme during the night, that's when they get aggravations. So if a patient has asthma, they would be having the attack around 1 to 3 a.m. and they would want a cup of warm water from which they would drink a little bit frequently, and they would feel extremely tired and weak and still be very anxious and restless and would want to change places, move from one place to the other. Sometimes in patients that require Arsenicum album, warmth would give relief. Warm air, warm room, hot applications. So you won't expect to find an Arsenicum album patient in an air-conditioned room, particularly when they are sick. And if they have fever, they are relieved by sweating. If they perspire, they would feel much relief. Dyspnea, or the asthmatic complaint, difficulty in breathing, would increase on moving, particularly while ascending stairs. And there are a lot of gastric symptoms. Among them, every symptom is increased after eating or drinking. Sometimes the patient would have vomiting and stool simultaneous. Materia is a medicine if you have vomiting and fever together. Fever with vomiting. High fever and vomiting. Materia is one of the medicines. There are Eupatorium and many others. But something that you would want to keep in your mind if there is a high fever and the patient is vomiting, is natremia, you may want to give it low, 3x or 6x, something like that. Vomiting and stool simultaneous, arsenicum elbow. No remedy is more restless than this one. Now, Nash would compare the restlessness of arsenicum with other remedies. So he says, the aconite restlessness comes in at the earlier stages of inflammation. Arsenicum comes in at the later stages. Aconite patient tosses to and fro in agony and fear. The arsenic patient is too weak to toss to and fro, as the anguish and restlessness would incline him to do. He cannot move without help. So he wants to be moved from place to place. He has fear of death, but not like that of aconite. Rather, it's an anxiety, a feeling that it is useless to take medicine, for he is going to die. He is incurable. Imagine a patient who is weak and restless, wants to move from place to place and feels chilly, is so anxious that he would prefer to die than live. So right now I have a patient. I would come back afterwards. Take care. I believe you would remember a little bit of arsenicum from today's lecture.